Hey, here we are at Speaking of Horses in Harrisburg, Pennsylvania, Horse World Expo. Having a great time here in the 2018 event. And I am talking right now to Tracy Baker. And Tracy is with Equaide.
Yep.
And it's a wonderful product. Matter of fact, I just learned about it a couple of weeks ago, and we're proud to say that they are joining the Speaking of Horses family and sponsoring. So first of all, welcome, and tell us a little bit about the history of how you got into this.
I was a veterinary technician working in southern Maryland, and one of my horses got hurt, and she grew proud flesh, and she was not able to have it surgically removed. So we went out looking for something that could take care of that for her. And in working with the veterinarians, and as I say, God on my shoulder, I looked up, did some research, and found some different minerals that really work well with changing the pH level, and it just came together really well, and we started selling it mainly through that veterinary hospital, and it worked removing proud flesh, preventing it from forming. It did not harm the healthy skin. So we started using it on more and more different animals, and now 20 years later, we're actually in our 20th year. We started this in 1998, and we're available all around the world. We ship it, we sell to a lot of veterinarians, and we love it.
Now, there's a lot of people that may not have heard of it, but you just said the key. When you started this, you started marketing through veterinarians.
Correct.
Okay, therefore, it may not have been something that the general public would have just seen unless a veterinarian recommended
Correct.
it, right?
Correct.
So when did you decide to start going out and doing a little more of this marketing?
We started, I couldn't really tell you exact year, but we were at Horse World Expo a few years ago. We were at other expos, and we were actually asked to speak at the American Association of Equine Practitioners, a large equine veterinary conference for continuing education of veterinarians, and we were discussed in one of their continuing education classes. So that really moved us to work more with the veterinarians because they were seeing most of these large wounds. We want to make sure that there's no tendon or ligament damage, any joint damage before they use our product. I don't want to go backwards in a wound for an owner. I want them to go forward and heal. So with doing that, more owners would contact us saying their vet recommended it, and so we just want to educate owners. We want to educate them on how to bandage and how to use our product. So we kind of went from the veterinarians to going back to the end user, which is the customer. This year we're really pushing for the customers.
Well, the other side of that, though, is that it's not something that you necessarily have to have the veterinarian apply.
Right.
This is something you, as a horse owner, can have in your first aid kit, your barn,
Yes.
or somewhere. Take it with you in your horse trailer when you're going to shows or trail rides.
Correct.
And if you have a wound of some kind that you need to deal with, it's not a veterinary applied or prescribed product per se.
Correct, that's correct. It is all natural. It's made of a proprietary blend of minerals, activated charcoal, and water, and it forms a good compound that it's safe for you to put on yourself. It's not going to damage your skin if you get it on your fingers. We do sell each jar with an applicator brush, just for safety reasons. But you're correct. It's something you want to have available immediately so that you don't form proud flesh, since it will prevent it from forming, especially on the lower limbs of horses. They're predominant with the proud flesh growth. But it can be used anywhere on the body. It stays where you put it. It forms a scab with the serum that comes out of a wound. It forms a matrix with that product, so that you have a scab. It's like a Band-Aid per se, but they don't have to worry about washing it and getting the most ointments and stuff will smear off. This stays where you put it. It's really a good product in that. It has many good uses.
And with every jar of this that you would obtain, you get a little instruction sheet, I'm sure.
Oh, absolutely.
But it's something that, and it is, if you've got a wound and you get to that wound quickly, you can prevent a lot of these side effects to that wound from happening, because you immediately jump in and restore some cleanliness, for lack of a better word, to that wound before too much infection, dirt, bacteria get in there.
Yes, and it's antibacterial and antifungal in its natural properties. We've had it bacterial tested, and we've had it also safety and efficacy tested, so it's safe to use on deeper wounds. Even we've had veterinarians that apply it right to the bone of horses that, you know, the owner may not have gotten to that wound, wasn't aware they're at work, the horse got caught in the fence, you don't know about it till you get home from work. These things happen all the time, and so the vet might come and apply it right to the bone and say, hey, you need to do this on a daily basis, and I'll be back in a few days, and then the granulation bed starts in, but you won't get an exuberant granulation bed, which is proud flesh. You'll just have a healthy granulation bed, and it reduces the chance of deeper infection. Equaide is just, it's been known that way, and it also takes care of MRSA, so of course you don't have to worry about that happening in the
Well, and the thing that I'm looking at too is like going on trail rides, and we've gone on trail rides. I had a horse a few years ago get injured on a picket line at a trail ride. We're out in the middle of, you know, nowhere, okay? And were it not for the first aid kit and what we had in it, we would have had no way to treat the horse. If this is in your first aid kit and you get a pretty nasty little cut, scar, you can bandage and everything, but you could do this and really prevent a lot of other bad things from occurring when you couldn't get to that veterinarian if you wanted him, right?
And you can use this under a bandage as well, so that if you had a really large wound on a trail and it's going to be hitting the dirt or the mud, you know, you're walking through mud to get back to your trailer head, you know, you can put this under a bandage. It's not going to hurt the horse.
So you've been in business 20 years.
Yes, we have.
And it's
very proud.
Now I say Equaide, you say Equaide. Equaide. It's Equaide. Okay. Because I know sometimes there's this difference between, do you say equine or equine? You know, you say potato, I say potato, but it's Equaide. You've been in business 20 years, and see, that's what, when I found you guys just a couple of weeks ago, I really wasn't familiar with you, and it's because, you know, if you're not marketing out, I don't see that many vets. Thank goodness my horses don't have that many problems. But now, you have horses yourself?
Yes, we have 11 back home on the farm right now. We have a 50-acre farm, and they're free out on 50 acres. We don't stall them every night. We've had bad weather these past few days, but we go out. We actually keep a jar on we have a four-wheeler or a golf cart, depending on the time of year, but we have a little bag that we keep, and we have halters and things like that, fence fixing supplies, but we also keep a jar of Equaide in that pouch, so if we go up to the horses and we're checking their legs or checking their bodies, if we see somebody a little cut, we quickly get on it.
You got it right there.
And then we can take them back to the barn if we need to, if it's a larger wound. But
so now how do people contact you?
We have an email, we have a website, and you can contact us through that contact page on there, and it does my email, which is tbaker@equaide.com. We have a toll-free number, 1-888-330-7107. I answer emails. I try to get on the phone as much as possible. Of course, being on the road is a little difficult, but I check my emails every day.
And to give people a background, you have some medical background to you.
Yes.
That's another key point. This is not just you coming up with a product. You have medical training as well.
Yes, I was a veterinary technician when I came up with this product, and then I became an RN. And I'm still an RN, and always will be an RN, but I worked in the ER and OR, and I became a nurse administrator for an ambulatory surgery center in central New York, and I love that job, but I left that recently, and I'm going on with helping more horse people. I enjoy this world a lot more than sitting behind a desk and doing paperwork. I enjoy helping horses and their people.
Well, and we're certainly glad that you have come on board and are part of the Speaking of Horses family of sponsors, and we will do everything we can, you know, to help as well. But it's a great product.
Yes.
And it's something you can put in the saddlebags, put in the first aid kit, put in the horse trailer, do whatever. So it's equaide.com, EQUAIDE.com. Look them up. Tracy, thank you very much.
Thank you so much for having us.
And stay with us. We're in Harrisburg, the Horse World Expo on Speaking of Horses.